Hello there and welcome once again to The Verdict. Mick Cornett with Meyers. We're here every week, meeting interesting people and dealing with topical issues, and we welcome back one of our favorite guests.
Yes, Julie Bisbee is going to join us when we get through with this introduction. And she's been on before, and we are pleased to run PSAs, public service announcements, for the organization she represents, which is the Tobacco Endowment Settlement Trust, otherwise TSET.
TSET.
Yep.
And we will learn more about TSET and also get into some specific areas that TSET is currently working on. It's all about improving the health of Oklahomans, and we'll get to it after this break.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other. And we're not going anywhere.
Military service ran in my blood, starting from my father, which joined the Navy, on the Chickasaw side, my uncle, which served in the United States Army. I'm Benjamin Espinosa, Chief Petty Officer, United States Navy, and I'm Chickasaw. I went to the Secretary of Defense's staff at the Pentagon in Washington, D.C., which ultimately led to becoming a combat support technician for Naval Special Warfare, specifically SEAL Team 10. I think to be proud and to love your tribe, to love being Chickasaw, you also have to love being American. You also have to love everything that America stands for. Equality, perseverance, professionalism, and power. I want my family to know that their father is a good person, but also feels that he has an obligation to the country and to love this nation. Anything worth having is worth dying for. The military and the country owes me nothing. I owe it everything.
See more stories about the Chickasaw people at profilesofanation.com.
Welcome back to the set of The Verdict. Mick Cornett with Kent Meyers. Kent's going to introduce today's guest.
As we indicated on the open, our guest today is Julie Bisbee, the Executive Director of TSET, which stands for Tobacco Endowment Settlement Trust, and she may want to give a little explanation of that when we come back. But she has did her undergraduate work in journalism at Ball State University. She was involved in journalism for a good number of years with newspapers around here in Oklahoma, and then she got hooked up with the Institute for the Oklahoma Institute for Child Advocacy. Oklahoma Institute for Child Advocacy, and she worked there for a while, and then joined TSET. We are really pleased that she'd give us her time. She's engaged in a venture that merits acclaim and benefits all of us. Julie, glad to have you.
Thank you. Thank you.
I want to jump into all these exciting things you're taking on, but I always remember, not everyone in our audience knows what TSET is, or if they've heard the term, they don't know the history. Would you mind spending a couple of minutes and just talk about how we got to the point of having this organization and effort?
Yeah, thank you. So TSET is a state agency. We were actually created by voters through a constitutional amendment after our state and many others sued Big Tobacco for the harms that they had for their customers, basically. And so what our state did that is really unique, no other state did it this way, is we created a constitutional endowment. So there is an endowment that annually takes payments from the tobacco settlement. As long as cigarettes are sold, our state receives payments. The endowment gets 75% of that annual payment, and the legislature and the attorney general split the remaining 25%. So we've been around for nearly 25 years, and as your viewers may know, endowments grow and they spin off earnings, and so What I do is work for the board of directors that oversees the disbursements for that endowment. And so we had some very specific charges in the Constitution and primarily reduce the toll of tobacco on our state and improve health. And so we've been making grants for more than 20 years now to that end. And it's really exciting to be here with you all today to talk about some of that.
What are the success stories of TSET now looking back, as you said, nearly 25 years? What looking back should we be most grateful for that TSET's been involved with?
Well, I think what most people know us for is the Oklahoma Tobacco Helpline. And that is one of our very first programs when the endowment was just in its early phases. Those early board members thought, what is something that we can do that will help Oklahomans in every county? And so they started 1-800-QUIT-NOW, which is something that has been running for nearly 20 years. And that is a 1-800 or now a website that folks can go to and either register online for coaching and free nicotine replacement therapy or talk to a coach. We know that when people who are trying to quit, whether that's cigarettes or smokeless or even vaping, when they talk to someone about their desire to quit, what they need help with, and get nicotine replacement therapy, that they are more likely to be successful. And so that's one of them. And, I always love to point out that adult smoking is at an all-time low. We're at about 15%. Still a little bit higher than the national average, but nearly cut in half from where we were when we started. So there are a lot of things to be proud of, but I think that's one that's really relevant and that a lot of people know us for.
And if someone wants to get involved or knows someone that really might be interested in the tobacco helpline, how do they activate it?
Yeah, they always, probably have seen our commercials, 1-800-QUIT-NOW or okhelpline.com. They can go and register.
They'll see one of those on this show.
Oh, excellent. Well, thank you for that. Those nudges for healthy choices are really important, and everybody quits in a different way. And most tobacco users have to try a couple of times. And for us, every quit attempt is a win because you learn something, and, people take 6 or 7 times to quit, so it is okay to ask for help, and that I'm so glad that you all carry that message. And
so what's new with TSET? You mentioned that that's been an ongoing success story, but what are you working on today that might not have hit the radar screen of most Oklahomans?
So as we've grown, people may know us for community-based programs. We have the TSET Healthy Living program, which is across the state, but we've also added some new grant categories over the years. 2 of them that we have launched over the last 2 years are the TSET Built Environment Grant and also our TSET Discovery Grants. I know being a former mayor and driving around and seeing all that construction that's happening in Oklahoma City with trails and parks, that built environment shapes our lives in many ways. Having a safe place to walk or a safe place to play increases your chances that you're going to get your family out and move. And so our built environment grants are available for governmental entities, nonprofits that want to invest in that infrastructure. We've recently awarded funds to folks down at the River Sport to kind of add amenities to those trails and make them not only friendly to runners, which my husband runs often down there, but also families and children and strollers. So those are some of the things that we might do through built environment. I know in our rural areas, cities have applied so that they can improve the sidewalks for folks that might have limited mobility. McAllister added ADA sidewalks connecting some of their health services to their downtown. Transportation is sometimes a barrier for folks in getting to those important services. And so linking that up, but also, people want to have safe and attractive places to play and be physically active. And so we want to be a partner in that. So that's what our built environment grant is about. And then our discovery grants are really looking at what's happening at the community level. What are some innovative ideas that people are piloting or pioneering to improve health? And so we have done 2 rounds of that right now. And some of those range from, grants to make sure that nurses in the NICU understand how to help babies and help get them home. Secondhand smoke plays into a lot of our sudden infant deaths, and so that's kind of related there. But also a discovery grant that we've done locally is with New View, which is a nonprofit that serves blind or low vision folks. And what they have done is create a walking track around their facility. So they do training and, jobs there, but they're also adding wellness. And the research does show that, folks with different levels of mobility sometimes have a higher tobacco use rate and often are looking for positive things to do in the community as well. And so that grant is infusing health in that group that they're serving, and we're seeing some really exciting things. They've added a community garden that their clients or patrons are using, getting healthy foods, things like that, really widening that and making sure that we have programs and services that health is for all.
I have to compliment you on the effectiveness, at least from a layman's standpoint, of your advertising. This new one that I see on the air now from time to time of the little children acting as though they are adults and talking about when they smoke.
Yes.
I thought that was particularly effective. Do you create these things in-house, or do you hire an agency to do it?
Yeah, so that one is attention grabbing for sure.
Yep.
When I smoke during my nap, we get a lot of comments. The children are actors and they are not smoking. We also give them kind of a really good introduction about why smoking is not good for you. But we do work with an ad agency that is based here in Oklahoma City. A lot of those ideas come from our staff or, the agency that we work with, but those are all locally produced and locally designed. Ideas really about how do we engage Oklahomans in this conversation.
I find them very effective.
Great. I'm glad you've seen them, and that's one I've been getting a lot of questions about. So thanks for bringing that up.
We're going to jump to a break. Julie Bisbee is our guest. She's the executive director of TSET, and we'll be back after this.
At Whitten Burridge, we're litigators. That's all we do. All of our clients, some sort of wrong has occurred to them. We try to right that wrong. Corporate America, they have all the power. It's sort of like going against an army. I like helping the underdog. That's what gets me up out of bed every day.
Our success rate is phenomenal, but that's not all they get. We care about people.
I'm very proud of what we've been able to do for our clients, and I'm looking forward to what we're going to do in the future. There's still a lot of wrongs that need to be righted.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank #2 in the nation. OU Law, generations of excellence, limitless possibilities.
One of the best kept secrets about the post 9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They are there to help you find the right school for you, the school that will help you and your family make great steps into your future.
New year, safer you. Get your safety on. This year, let's all make it home safe. Make Oklahoma safe.
We're back on the set of The Verdict. Mick Cornett with Kent Meyers. Kent, where do you want to go now?
Teen vaping.
Okay.
I want to talk a little bit about teen vaping. What is TSET's role in trying to assist in lowering the numbers?
Yeah, so teen vaping is a problem that a lot of states are seeing. And in our state, you know, we're no different. Young people are getting access to products that have a lot of nicotine. Sometimes those vapor devices have as much nicotine as a pack of cigarettes. And so it's highly addictive. For young people, your brains are still forming before the age of 25. And so anything that you're learning kind of sticks with you during that time. So it's really important to us that we're being part of the solution to reduce teen vaping. There are a couple of things that we're doing, of course. We have some commercials that are running. Behind the Haze is one of the commercials you may have seen where it's talking about vapor products are not harmless. They don't just contain water. They contain chemicals. You're putting liquid into your lungs. That's not a good thing. We are also running a campaign right now talking about how young people vape together. They feel like that's something that's going to release stress or, calm them down. And quite frankly, it's the opposite. That nicotine is a stimulant. It increases anxiety, makes it harder to concentrate. And so one of those brand ads is really looking at, this is your friend and you help them get started, help them quit. We also have My Life, My Quit, which is a text-based cessation. You know, young people are on their phones a lot. My teenager is always on the phone texting. So that's where we're kind of meeting young people where they are to say, this is something you can quit. It's going to probably take practice and you should start and you should try. And so those services are available as well. And that's mylifemyquit.com. You can text in and you'll receive those supportive texts. It's really, how do we as a society kind of educate young people when we know we were all young once and very much never got a bruise or a scrape or we were bulletproof, as they say. And so sometimes it is just reminding young people that what you do today will have an impact tomorrow. And where do you see your future self? Spending a lot of money on vapor products because you have a hard time getting through the day, or using that money to, buy a new car or, something that is part of those goals. So we really try to be supportive of that and also get that information into schools and then offer services and promotions that let young people know not everyone is vaping and it is not harmless.
Compare rates of teen smoking to rates of teen vaping.
Yeah, so a success story that we should all be proud of is that there has been a huge decline in young people smoking cigarettes. That is a win. That definitely is a win. Unfortunately, we are seeing our rates of teen vaping kind of pop up. This is not something that we've always had data on over the years. It's a fairly new phenomenon. But we are, roughly just below the national average for teen vaping.
The legislative session is going on. What's got your eye out there, and what are you trying to accomplish?
Yeah, so looking at policies on vaping is one way that you help to reduce vaping. Vapor products are not currently taxed like tobacco products, and we know that when we put a tobacco tax in place, it decreases consumption, especially among young people. So that's one thing that
What's the hold up there? It's just because it's a tax?
Taxes are hard. I think that there's a lot of discussion around what the rate should be. Our position is that taxing addictive products should be across the board because we want to discourage that. We want to discourage that dependency and use. But there is a lot of discussion about that. I think it is a policy that's well past its time. Something that they should be talking about. And there have been bills out there, but we just haven't seen one go across the finish line. So, it usually takes a couple of sessions for a tax. But yes, that's a great question. Other things that we're looking at for reducing youth access to tobacco is increasing funding for compliance checks. The age to purchase tobacco increased to 21 under the Trump administration. And then it was COVID, so there is kind of a learning curve. A lot of retailers are getting that education, but it always helps when you know someone will be checking and asking if you're complying with the rules. So compliance checks, funding. We are also keeping an eye on a bill that would increase the fines for selling tobacco products to people under 21. The current fines are very low and kind of out of step with the fines that we might have on other substances like alcohol. So Representative Cynthia Rowe has a bill that has made it through the, sort of the first half of session that would increase fines for selling tobacco products and vapor products for the store and also the clerk that might be selling. And so it's just putting that framework in place to say, these are the rules, making sure that folks are educated on the rules, and then, checking to make sure that those rules are being followed.
What's on the drawing board for TSET? What do you see TSET doing 5 years, next year?
Yeah,
whatever?
How big is your vision is kind of the question that people, ask and throw out there. But we are so fortunate as a state to have this endowment set aside for health purposes. A lot of states use that tobacco money for different things, and I think it's really a testament to the leadership at the time and also support of the voters that we continue to have this available. So some of the things on the horizon, we continue to try to support Oklahomans in their quest to be healthy through our Shape Your Future program, looking at ways that we can prevent and reduce obesity through encouraging Oklahomans to move, eat better, and be tobacco-free. So you will see those commercials out there. We're talking about sleep. As the research is growing around sleep plays into, your hunger, your desire to get active, all of that, your mental health. You'll see some of those messages out there. And then, I think we are always looking to grow our partnerships. In Oklahoma, change gets made at the local level by folks coming together with a mission and a passion in doing that. And so we are going to be, getting out and about in the state more and more to say, what are organizations doing that are working? How do we partner where it makes sense? How do we help expand that work? And so you'll see us. You'll see us out. You'll see incentive grants, communities coming to the table to improve their communities or their schools. I think all of those things are very positive.
We got about a minute left. What would you like Oklahomans to know about TSET or about the ways that they can improve they and their family's health?
Yeah, great question. Well, for those that may have a tobacco user in the home, 1-800-QUIT-NOW. It's free. Try it. It reduces the rate of preventable diseases when you quit smoking. You feel better. Your food tastes better. So that would be the first thing. Try the helpline. I think also, Oklahoma still has room for improvement. We still have loopholes in our protections against secondhand smoke. And so keeping an eye on that. Cities in Texas can pass smoke-free ordinances, but our cities can't. And so residents that want to be passionate about that should talk to their elected officials, talk to their lawmakers, because that is something that still we need room for improvement there. And, supporting your schools and your communities in efforts to help increase physical activity. Those walkability things are super important. In creating places where we want to be, but also creating spaces for taking a nice walk on an afternoon or things like that. So, yeah, great question. Thank you.
Julie Bisbee is the Executive Director of TSET. Thanks so much for coming on the show again.
Thank you.
Yeah, thank you.
Thank you.
Kent and I'll have a final word when we return.
This is the epidemic of my generation. This is my HIV. This is my Black Plague.
In the midst of one of our state's largest crises,
Oklahomans are dying from this preventable and treatable disease on a daily basis.
We believe there's hope.
That little pill will cause destruction through your whole life.
Watch the entire award-winning 9-part docuseries Killing Pain, made available by Fighting Addiction Through Education at killingpain.com.
It used to be okay in teachers' lounges. It used to be okay in maternity wards.
It was okay in sporting arenas, college campuses, and office spaces. But now that we understand the deadly dangers of secondhand smoke, that's not okay anymore. So why is it okay that thousands of employees are exposed to it every day at work? Bottom line, it's not okay. Let's protect hardworking Oklahomans. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
I think for us, once we got started and we began to see the tremendous need just within our state, it really was just a calling for us. The blessings far outweigh any obstacles that we've faced.
You will always be mom and dad to me.
Welcome back to the Set of the Verdict. Mick Cornett with Kent Meyers, wrapping up the show with Julie Bisbee. She's the Executive Director of TSET.
Well, a lady on a mission, and a mission that is good for all of us, whether we smoke or not, particularly the programs about secondhand smoke.
I like the fact that they're also getting into more of the built environment, which means parks and sidewalks and senior wellness centers, everything that government can do to provide to its citizens that might lend itself to them living a healthier life, and perhaps more importantly, teaching the next generation about living a healthier life. You can get more information about Julie's work at tset.ok.gov, and we have a website, theverdict.tv. You can tell us about a guest you'd like to see or a subject you'd like to see us touch on. We'll see you next week.